And shifting a little bit to think about like public perception,
Mhm.
how do we shift the narrative so that public health professionals are seen as everyday change makers rather than just crisis responders?
Right. Well, I think that to shift this narrative, we must tell more stories highlighting public health professionals because we are behind the scenes work, right? So we need to stop that and we need to really start telling people what do we do. So public health professionals do far more than respond to crisis. So they are foundational to our daily well-being, and we need to really tell those stories. From reducing infant mortality to combating the opioid epidemic to preventing infections. So our work saves lives in ways that many may not even realize. So we must tell these success stories consistently, demonstrating how public health improves healthy longevity, equity, overall quality of life of everyone. So we also need to start engaging more with the media, leveraging social platforms, and fostering community partnerships. All of these can help make all our contributions more visible. We must communicate better with more clear, relatable messaging that really relates with all the people. We need to address misinformation. We need to promote trust and all key strategies really we need in order to change the public health perception. We need to change the public health perception. We recently actually in ASPPH released an updated version of our messaging guide that you can, all our audience can look in our ASPPH website in order to really learn more about what are the key messages that we need constantly to be reminding everyone. So I think that that's some of the strategies, Omari, that require.
And I appreciate the highlighting of the stories because stories are what really resonate us and connect us as human beings and to the unified narrative that we have here on Earth. And I think being able to share those stories and share the impact and like resonate and say, oh, wow, that could have been my community. That could have been, and I just understand that I think is such an important narrative to really push forward.
Absolutely. Absolutely. I'm with you on that. Mhm.
And then with your perspective as president of the Association of Schools and Programs of Public Health, talking about workforce resilience, I'd imagine is a
Mhm.
conversation that you'll talk about a
Oh,
lot.
yeah.
What are some of the strategies that we
Yeah.
can use to strengthen the public health workforce, particularly giving funding cuts and increasing global health threats?
That's a big issue because investing in public health workforce means investing in our collective future. So that's the story behind what we do, right? So we must prioritize several things, but I will just name or list some of them. So, for example, sustained funding. So right now, the way it works is that we have episodic crisis-driven investments, right? So you name it, you have like, for example, the COVID-19, there's a lot of funding for that. We have the hurricane and we have funding for that. So those are episodic funding. We really need more like to change that circle to a circle that's more of a virtuous circle, right? Where really the funding comes the whole time, because we need prevention and we need promotion, and of course the crisis will gonna come and we're gonna be ready for that, but the funding has to be really constant. So really trying to advocate for sustained funding is key for the things that we do. Another thing is that we need to really do more to really have stronger academic and public health partnerships, right? To really equip like our professionals with real world experience, and they can have the experience when they work in their communities. We need to also think about the workforce well-being. They are really burnout. There's a lot in their place. You know, even when we have the COVID, at that time there were several surveys in place, and one of them were talking about that one in every five employee so they were really showing stress and really symptoms, and then 56% of them already reported being stressed out. So we really need to pay attention to their well-being. So we don't we not only need more public health workforce, but the one that we have, we need to protect them. We need to really take care of them. The other thing that our public health workforce needs, to be resilient, is of course development. We need to train them. We need to expand all the training programs like on the job work. We need to offer them tuition in order to support their continuing education, creating career pathways to attract and retain talent. A lot of our public health workforce, they don't have a training in public health. As a matter of fact, most of them, they don't. So we need to really continually really working with them and training them and being with them on the job in order to support their work. We need to do more cross-cutting, like cross-sector partnerships, not just rely on the government, but in the private sector, in foundations and in others to really support our work. Right now, more than ever, we need these cross-cutting, cross-sectoral initiatives and partnerships. We need to communicate better with our communities and be more engaged with our communities. They are great people and organizations on the ground that, if we partner with them, could be great in order to really together have a support and network community. So those are just some of the things that we can do in order to really be more, supportive of our public health workforce.
Well, I appreciate you highlighting that, and I think it goes to show the opportunities that are out there for people in public health to create new ways to support the workforce and to create more of a thriving workforce, because there's so many different parts that are needed, and we need people that are thinking about these big issues. And I think that sustained funding is so important as well.
Absolutely. But we need everyone to be just thinking about a career in public health, because the future is us. As long as we have humans, as long as we have a planet, we need people, we need workforce in public health that really can help us really continue living and being healthy. So yes, you're right.
Yeah. Absolutely, and it all goes back to like that storytelling and that narrative to really get public health and show the importance and why it is not something that should just be pushed to the side, but should be maybe one of the first line items in the budgets when we're thinking about this kind of work.
Absolutely.